it's land or.
And thank you for joining our bi-weekly COVID-19 briefing. As always, we'll be hearing from Health Commissioner Dr. Cheryl Bedegal. Today, she's being joined by Mayor Jim Kenney and Acting Managing Director Vanessa Garrett-Harley. As a check the Health Department's social media accounts for the link to the briefing. Because we have additional speakers, and I'm sure plenty of questions, today's briefing will run until at least 10:45. As usual, then I'll open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions, and that we limit questions to 3 or fewer. Please keep your questions focused on the topic of the COVID pandemic and the city's response to it. With that out of the way, Mayor, would you start us off? Mr. Mayor, are you here with us?
I'm here. I just couldn't. You cut out.
Oh, sorry. We're ready for you whenever you are,
Okay.
sir.
Well, thank you, Jim, and good morning to everybody. First, I want to thank and recognize the Health Department and our incredible health partners citywide for their leadership and response to the Omicron surge. After a difficult start of the year, it is a relief to see cases, hospitalizations, and positivity rates dropping. And I'm confident that the precautions we all took as a city and as individuals helped us get through the surge. I know it has not been easy, but I'm so proud of everyone, our people, our communities, and our local businesses and organizations who heeded the guidance of our public health experts as we continue to navigate COVID-19. As we close in on marking 2 years of combating the pandemic next month, I want to thank everyone for doing their part to beat back the virus. Simple things like wearing a mask and getting vaccinated. We fully recognize this virus will be with us for the foreseeable future, and we must learn to move forward together in ways that promote public health and reflect the realities of life and society. In turn, we are all committed to being as prepared as we can for changes in the pandemic. That includes being prepared for times when risks are lower and fewer restrictions are needed. With that in mind, the city has been developing a COVID response levels to guide our protective measures going forward. And Dr. Bedegal will outline those levels this morning. While we are not done with COVID, and in no way are we declaring the end of the fight against the pandemic, I am glad that we have reached a point where we know much more about this virus and which strategies will help us manage its spread. And we are so grateful to the residents and businesses using those strategies every single day. Your efforts protect everyone. And thanks to you, we are in a place where we can chart a safe and data-driven course, doing more of the things we love and miss. And I remain confident that our great city will get through this together. For details on our plans moving forward, I'll now hand it back to the Health Department and Dr. Bedegal.
Thank you very much, Mayor. Dr. Bedegal.
Okay, so thank you, Mayor. So we've got a couple of announcements today, and perhaps the least hidden secret in Philadelphia this year. But first, I wanted to give the latest numbers on the pandemic. As of yesterday, we are seeing an average of 189 new cases of COVID per day, compared to more than 500 cases per day last week. That's down nearly 95% from the peak just over 1 month ago. The percentage of tests that are coming back positive is now down to 2.9%. And yesterday, we reported that 300 people who tested positive for COVID were in Philadelphia hospitals. That's down nearly 80% from the peak. Looking at vaccines, more than 95% of Philadelphia adults, 90.2% of those 12 and up, and 53.1% of children 5 to 11 in Philadelphia have had at least one dose. More than 80% of adults and 74% of those 12 and up are fully vaccinated. And 31% of adults have received a booster dose. These numbers are very encouraging, but we still need to be careful. Throughout the pandemic, we've seen that COVID-19 cases track with poverty, and we've seen people of color experience the worst outcomes. So it is particularly striking that since the mask mandate in Philadelphia was implemented in mid-August, the city has generally seen lower case rates than the surrounding counties, each of which is more affluent and less diverse than Philadelphia. Local rules need to fit the local conditions, and Philadelphia's mask mandate is a great example of how that can work in practice. We are the poorest big city in America. We have many frontline workers who do not have the option of working from home in safety. And historic and present day racism have unfortunately dramatically impacted the trust that many people of color have in healthcare, in public health, and in COVID vaccines. While we're committed to winning that trust back, we also need to do everything possible to keep people safe, given the conditions that exist today in our city. While case rates and hospitalizations remain relatively high, the mask mandate gives protection to those who are not yet vaccinated. Philadelphia's vaccine mandate for dining establishments has been hard on our restaurants and on our places of entertainment. But the work those establishments have done has helped to decrease transmission and to increase vaccination rates in the city. Omicron hit all areas of the country hard, Philadelphia included. Case rates are dropping everywhere, but they're dropping farther and faster in Philadelphia than in many other parts of the state and the country, thanks to the work Philadelphians have done to keep each other safe. So I'm happy to announce new COVID response levels that mean that as of today, we no longer need to ask our city's dining establishments to check vaccines. The new response levels are based on case counts, positivity, hospitalizations, and the rate of change in cases. And they'll provide transparency into what city residents and business owners can expect going forward. We are creating 4 levels of response. I know you know this, but I'll walk through it. Extreme caution, caution, mask precautions only, and all clear. Based on today's metrics, Philadelphia has just entered the mask precautions only level, meaning, as I mentioned, that the vaccine requirement for people entering establishments that serve food or drink is no longer in effect. We are posting the detailed metrics we're using to define each of these response levels on the phila.gov/COVID website. When the vaccine mandate was announced, we were in the midst of the Omicron wave, and only 27.5% of Philadelphia's children aged 5 to 11 had had a first dose of COVID vaccine, slightly ahead of the national level, which was then 20.3%. Today, cases are dropping rapidly, and 53.1% of the city's 5 to 11-year-olds have had their first dose of vaccine, compared to 31.8% nationally. A huge jump forward, although more work remains to be done. This leads to today's second announcement, a new incentive program for vaccination. Beginning this week at Health Department community clinics, Philadelphians who complete their primary COVID vaccine series will receive $100, funded through a grant from the CDC. Because of safety concerns, we won't just be handing out $100 bills, but folks can either receive the funds through a digital app in a couple of days or a physical gift card by mail in a couple of weeks. If you've been trying to get motivated to get your second dose of Pfizer or Moderna, this is your moment. We're posting details on the incentive program and which clinics will be giving away these incentives on the phila.gov/COVID website and on our Twitter account. The program is tentatively scheduled to run for 6 weeks. So if you haven't had any doses of COVID vaccine yet, you can still get your shots and be eligible for the $100 incentive. We are very excited about this program and hope it continues to encourage folks to get fully vaccinated. That could help us to get to the point where we can lift our remaining COVID restrictions and prevent us from needing them again. As always, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Zelly to present both the mayor's and my remarks in Spanish. Thank you.
Buenos días. Este es el mensaje del alcalde de Filadelfia. Primero, quiero agradecer y reconocer al Departamento de Salud y nuestros increíbles socios de salud en toda la ciudad por su liderazgo y respuesta al aumento de Omicron. Después de un comienzo de año difícil, es un alivio ver caer los casos, las hospitalizaciones y las tasas de positividad. Y confío en que las preocupaciones que todos tomamos como ciudad y como individuos nos ayudarán a superar el aumento. Sé que no ha sido fácil, pero estoy muy orgulloso de todos, nuestra gente, nuestras comunidades y nuestras empresas y organizaciones locales que prestaron atención a la guía de nuestros expertos en salud pública a medida que continuamos navegando el COVID-19. A medida que nos acercamos a marcar 2 años de lucha contra la pandemia, el próximo mes, quiero agradecer a todos por hacer su parte para combatir el virus. Cosas simples como usar máscara y vacunarse. Reconocemos plenamente que este virus estará con nosotros en el futuro previsible y debemos aprender a avanzar juntos de manera que promuevan la salud pública y reflejan las realidades de la vida y la sociedad. A la misma vez, todos estamos comprometidos a estar lo más preparados posible para cambios en la pandemia. Eso incluye estar preparado para los momentos en que los riesgos son menores y se necesitan menos restricciones. Con eso en mente, la ciudad ha estado desarrollando niveles de respuesta COVID para guiar nuestras medidas de protección en el futuro, y la doctora Bergo describirá esos niveles esta mañana. Sí, bien, no hemos terminado con COVID y de ninguna manera estamos declarando el fin de la lucha contra la pandemia. Me alegro de que hayamos llegado a un punto en el que sepamos mucho más sobre este virus y que estrategias nos ayudarán a gestionar su propagación. Y estoy muy agradecido por los residentes y las empresas que usan esas estrategias todos los días. Sus esfuerzos protegen a todos. Y gracias a usted, estamos en un lugar donde podemos trazar un curso seguro y basado a datos para hacer más de las cosas que amamos y extrañamos. Y sigo confiando en que nuestra gran ciudad superará esto juntos. Para obtener detalles sobre nuestros planes para avanzar, ahora la devolveré al Departamento de Salud. Esas son ahora las palabras de Dr. Bergo. Muchas gracias, alcalde. Tenemos un par de anuncios hoy, pero primero quería dar los últimos números sobre la pandemia. Hasta ayer estamos viendo un promedio de 189 casos de COVID por día, en comparación con más de 500 casos por día la semana pasada. Eso es casi un 95% menos que el pico hace un poco más de un mes. El porcentaje de pruebas que están dando ahora positivo se ha reducido al 2.9%. Y ayer informamos que 300 personas que han dado positivo por COVID estaban en hospitales de Filadelfia. Eso es casi un 80% menos que el pico. En cuanto a las vacunas, el 95% de los adultos, el 90.2% de los mayores de 12 años y el 53.1% de los niños de 5 a 11 años en Filadelfia han recibido al menos una dosis. Más del 80% de los adultos y el 74% de los mayores de 12 años están completamente vacunados y el 31% de los adultos han recibido una dosis de refuerzo. Estas cifras son muy alentadoras, pero aún así debemos de tener cuidado. A lo largo de la pandemia, hemos visto que los casos de COVID-19 se registran con progreso y hemos visto a las personas de color experimentar los peores resultados. Por lo tanto, es particularmente sorprendente que desde que se implementó el mandato de máscaras en Filadelfia a mediados de agosto, la ciudad generalmente ha visto tasas de casos más bajas que los condados circundantes, cada uno de los cuales es más rico y menos diverso que Filadelfia. Las reglas locales deben ajustarse a las condiciones locales y el mandato de máscaras de Filadelfia es un gran ejemplo de cómo eso puede funcionar en la práctica. Filadelfia es una gran ciudad más pobre de los Estados Unidos. Tenemos muchos trabajadores de primera línea que no tienen la opción de trabajar desde casa con seguridad. Y el racismo histórico y actual desafortunadamente han impactado dramáticamente la confianza que muchas personas de color tienen en la atención médica la salud pública y en las vacunas COVID. Sí, bien, estamos comprometidos a recuperar esa confianza. También debemos hacer todo lo posible para mantener a las personas seguras, dadas las condiciones que existen hoy en día en nuestra ciudad. Sí, las tasas de casos y hospitalizaciones siguen siendo relativamente altas. El mandato de la mascarilla brinda protección a quienes aún no están vacunados. El mandato de vacuna de Filadelfia para los establecimientos gastronómicos ha sido duro para nuestros restaurantes y lugares de entretenimiento. Pero el trabajo que han realizado nuestros establecimientos gastronómicos ha ayudado a disminuir la transmisión y aumentar las tasas de vacunación en la ciudad. Omicron golpeó duramente todas las áreas del país, incluyendo a Filadelfia. Las tasas de casos están disminuyendo en todas partes, pero están cayendo más lejos y más rápido en Filadelfia que en muchas otras partes del estado y el país, gracias al trabajo que los habitantes de Filadelfia han hecho para mantenerse seguros unos a otros. Así que me complace anunciar nuevos niveles de respuesta a COVID que significan que a partir de hoy ya no necesitamos pedir a los establecimientos gastronómicos de nuestra ciudad que revisen las vacunas. Los nuevos niveles de respuesta se basan en el recuento de casos, la positividad, las hospitalizaciones y la tasa de cambio en los casos y proporcionarán transparencia sobre lo que los residentes de la ciudad, los propietarios de negocio, pueden esperar en el futuro. Estamos creando 4 niveles de respuesta: precaución extrema, precaución, precauciones de máscara solamente y todo claro. Con base en las métricas de hoy, Filadelfia acaba de ingresar al nivel de precauciones de solo máscaras, lo que significa que, como mencioné, que el requisito de vacunas para las personas que ingresan a establecimientos que sirven comida y bebida no está vigente. Hemos publicado las métricas detalladas que estamos utilizando para definir cada uno de estos niveles de repuesto en el sitio web de phila.gov/COVID. Cuando se anunció el mandato de la vacuna, estábamos en medio de la ola de Omicron y solo 27.5% de los niños de Filadelfia de 5 a 11 años habían recibido una primera dosis de la vacuna COVID-19, ligeramente encima del nivel nacional, que entonces era del 20.3%. Hoy en día los casos están disminuyendo rápidamente y el 53.1% de los niños de Filadelfia de edad de 5 a 11 años de la ciudad han recibido su primera dosis de vacuna, en comparación con el 31.8% a nivel nacional, un gran salto adelante, aunque queda más trabajo por hacer. Esto lleva al segundo anuncio de hoy, un nuevo programa de incentivos para la vacunación. A partir de esta semana, las clínicas comunitarias del Departamento de Salud, los habitantes de Filadelfia que completen su serie primaria de vacunas COVID recibirán $100 financiados a través de una subvención de la CDC. Debido a preocupaciones de la seguridad, no solo entregamos billetes de $100, sino que las personas pueden recibir los fondos a través de una aplicación digital en un par de días o una tarjeta de regalo física por correo en un par de semanas. Si ha estado tratando de motivarse para obtener su segunda dosis de Pfizer o Moderna, este es su momento. Estamos publicando detalles sobre el programa de incentivos y qué clínicas regalarán esos incentivos en el sitio web de phila.gov/COVID y en nuestra cuenta de Twitter. Este programa está propagado tentativamente para funcionar durante 6 semanas, pero lo que sí aún no ha sido ninguna dosis de la vacuna COVID, aún puede recibir sus vacunas y ser elegible para el incentivo de $100. Estamos muy entusiasmados con este programa y esperamos que continúe alentando a las personas a vacunarse por completo. Eso podría ayudarnos a llegar al punto en que podamos levantar nuestras restricciones restantes de COVID y evitar que las necesitamos nuevamente. Como siempre, si desea más información sobre la pandemia y la respuesta de la ciudad, puede visitar a nuestro sitio de web en fila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Gracias. Thank you.
Thank you very much, Zelly. We'll now move to the question and answer portion of today's program. As a reminder, we have Dr. Bedigal, the mayor, and the acting managing director available for questions. If you do have a question, please use the raise your hand function, and we'll take those questions in the order received. As noted earlier, we ask that media outlets coordinate internally and keep their questions focused on today's topic. If there are any reporters who do not get the opportunity to ask a question or have questions about other topics, please follow up with us by email and we will get you an answer. First up, we'll go to Annie McCormick from 6ABC. Go ahead, Annie.
Thanks, James. Dr. Bedigal, I just wanted to know, based on today's metrics and now at 2 years, and now, can you hear me? I'm sorry, I just got a notice that said you couldn't hear me.
Oh, no, I can.
You're good.
Okay. Based on today's metrics and now at 2 years of watching numbers and maybe having a better idea than 2 years ago how things are going, I know you can't make predictions, but what is your timeline that you think that the city could reach the all clear point?
Well, as is always true, it depends what happens next, right? So it depends what we do and it depends what COVID does. So assuming Philadelphians continue to be careful, I mean, we are not perfect, but generally we've done a pretty good job with masking and with precautions. So assuming that continues and assuming that there's not another new variant, it looks like we could be there in just a few weeks. So I'm crossing my fingers and my toes, but the numbers are looking good. We would need 3 of the 4 metrics. I think the case count is the one that we are most optimistic about reaching before we would reach the hospitalizations, just because hospitalizations tend to lag.
Okay, and then for restaurants and specifically for catering facilities, the difference of days or weeks could be huge for them in regards to booking big events. And especially for facilities that border the collar counties that don't have a mask mandate, they're really losing business. So what do you tell those businesses if you think it could be an all clear in weeks about how to promote themselves?
Well,
meaning could they say, hey, in weeks we could be without masks, so you wouldn't have to wear masks at your wedding or whatever the event is?
Yeah, so a couple of things. One, it is still true that anyone who wants to hold an all-vax event, so no exemptions, can do that without masks. And that's been true for months. So that hasn't changed. We're still allowing that. I think it's fair to say that we could be mask-free in a few weeks. I don't think we can promise that because we just can't predict the behavior of this virus.
But for businesses that have already been patient for 2 years, some people are literally holding on. Some of these restaurants and facilities. I mean, at what point do you continue to ask them to be patient?
I think that there are many, many ways in which this pandemic has been incredibly difficult for people. Rolling back the mask mandate before we hit the metrics puts us at risk of going backwards, of having cases multiply. We saw what happened over Christmas. So there's a reason that we're keeping it as long as we are. We're keeping it until the CDC recommends. The line between moderate and substantial transmission is really where that line is. But I don't want to promise to roll it back before then because we really just have to follow the data.
Okay, can I ask one more question, or James, do you want me to wait till the next one?
No, Annie, that was a follow-up. You can get one more.
Okay, and then for the city, and forgive me, I cannot remember the name of the campaign right now. I'm blanking on it, to bring people back, Mayor. Do you know what I mean? The campaign, we just had the event at Dilworth Park. Is there anything different as far as your strategies and the promotions that you're doing now with this new information that we have with new metrics and the tiered system that you're able to do to, bring more events or more people in?
The key to all of this is being disciplined, following the rules, getting vaccinated, and wearing your damn mask. I mean, this is not rocket. It's science, but it's not rocket science. And for all the refusals to cooperate, to mask mandates, vaccine mandates, threatening school boards, all this is just total nonsense. We will get there, and we've gotten where we are now because we've done the things that were hard to do that everybody back 2 years ago told us not to do. If we listened to the restaurateurs 2 years ago, we'd have 2,000 more people dead in the city. They didn't want to close anything down. So it's just being patient and getting to where we got to be to take everything away and get back to normal. But you can't get back to normal if you jump the gun and put things ahead of the cart before the horse. I mean, I have taken great pains to follow the science and follow the medicine. And that's what we're going to continue to do. And you can throw all the politics and other arguments in it. This is what we need to do to be safe. And I can't not get over the fact that people don't understand that this is a health emergency, that they need to be disciplined and follow the rules in order to get out of it. Everybody's looking for a route around it. So, we're going to get there when we get there, and that's just the way it is.
Okay, and just as a follow-up, and the argument is there not everybody who does agree with you and does agree with how the government is, putting in mandates and whatnot, and they're still your constituents. But yeah, in regards to, businesses and the, events that you want to bring to the city, do you think that this tiered system gives a better timeline?
I think this tiered system is safe. It's safe. It's about safety. It's not just about money. It's just not about business. It's about safety. People died over the course of the last 2 years. People are deathly sick over the course of the last 2 years. And we have to just grow up and be adults and get it done.
Thank you very much, Annie and Mayor. We'll move on now to Johan Calhoun with Chalkbeat. Go ahead, Johan. Are you with us, Johan?
Can you hear me?
Yes.
Okay, these questions are for Dr. Bedigo. First one with these new numbers, has masking, quarantine, and isolation recommendations for schools changed?
No. So the schools conversation is one we are having with the school district and with the other schools. And those are separate and parallel conversations. So of course, the same metrics are of interest, but we need to make those decisions together with them.
Okay, and let's see here. Changes that have been made and the talks that you're having with the school district now, are you guys also taking a look at what's happening in districts in New York, Baltimore, and DC and making these decisions?
So when we're looking at how to make these decisions, we're looking all over the world. And we're looking so much at what are the decisions people are reaching? We're looking at what's happening. So in a place, for example, that opens up, what happens to cases? Those kinds of things. I'm less interested in kind of the tipping point phenomena. I think we saw this kind of surprising thing happen a few days ago in which a group of governors collectively decided to get rid of mask mandates well ahead of the CDC recommendation. And, that was surprising. I don't necessarily want to follow that. I'd like us to follow the science because we know, the more cases, the easier it is for somebody to get in contact with somebody with a case and the easier it is for spread to happen. So we're looking at what happens nationally and internationally, but more with an eye to what does that tell us about what may happen in Philadelphia.
Mm-hmm. And there was concern about the low vaccination numbers for African Americans, Latinos in Philadelphia. How are numbers for these communities for people under the age of 18 now?
They've come up a lot. We still have some disparities. You can see all the data by age group and by race and ethnicity on the phila.gov/COVID site. It's all up there on the dashboard. But it's definitely improved over the last few months.
And to be sure, just to be clear, face masking and quarantining for schools, that has not changed, even though everything else across the city has.
That has not changed. We we'll be having discussions with the school district, but no change there.
Thank you.
Thank you very much, Johan. Next up, we're going to go to Mike D'Onofrio from Axios Philly. Go ahead, Mike.
All right, I think I'm on here. So how about this? Can you just please describe each of the 4 levels, these new levels of response to the pandemic? I feel like I'm still a little confused, not clear exactly what the city is saying here with this tier system.
Sure, happy to do that. So there are 4 levels, and I can talk through what they mean for individuals and then talk about the metrics. But the levels are extreme caution, which is the restrictions we currently have. So you need to present proof of vaccination to eat indoors, or to enter a place that offers food or drink. You need a mask indoors. Next level, level 3, is caution. There we allow either vaccination or proof of a negative COVID test within 24 hours. And again, the indoor mask mandate applies. Level 2 is mask precautions only. There's not a vaccine mandate for places that serve food or drink, but just the indoor mask mandate. And then the all clear, when we're not enforcing either the vaccine mandate for establishments that serve food or drink or the indoor mask mandate, other than in those specialized settings like healthcare or public transit, et cetera. So I can talk through the metrics of that if that's useful. Is that what you wanted me to do?
No, you don't need to go into the metrics. I appreciate that though, but just the levels are fine. Maybe my second question, just as levels drop, if you could maybe look in your crystal ball here, do you expect these vaccine mandates, masking, things like that to be put in place, back in place every winter if cases go up, considering the type of virus this is?
I've been thinking about actually buying myself a crystal ball for when people ask questions like that. I really hope not. We are really making good progress on vaccination. It does depend what other variants emerge. So I can't promise that we won't have to reinstitute these restrictions after we roll them back. If we were to have a severe new variant, that could happen. But, if you look at the waves, it's not necessarily every winter. It's when a new variant emerges, and that can happen. We've seen that happen in the summer. Hopefully we will get enough vaccine to other parts of the world that we can stop these new variants from emerging. But it is very much an open question. We're really hoping not to have to go backwards and trying to do this carefully so that we don't have to go backwards.
Cool, thanks.
Thank you so much, Mike. Next up, we're going to go to Jeff Cole from Fox 29. Go ahead, Jeff.
Yeah, hi. For Dr. Bettergoal, first, Dr. Better, I just want to be clear here so that I know. When we move to the all clear in a few weeks, as you have said, that's just not for the restaurant industry, correct? That is all clear throughout the city, no masks indoors. Is that right?
Well, there are some exceptions. So, federal law still requires masks on public transportation. We require masks in healthcare institutions and congregate care facilities, nursing homes. And the discussion about schools is separate and needs to happen with the district. But for all other places, going to a mall, going into a shop, going into a public building, unless it's a private business that has asked people to continue wearing masks, which they can do, but it would be the indoor mask mandate everywhere except those specialized locations.
Yeah, just as a follow-up, when you say a few weeks, I don't know, 2 weeks, is a few weeks, 2 weeks, or 3 weeks? Is that how you define a few?
It's a few.
Exactly.
So we need to get under 3 of the 4 metrics. The case count is the one I think we'll hit before we hit hospitalizations. We also need to get under 2% positivity, but I think we'll get there. Cases are already falling, so that's one of the metrics. So it means it's really a question of when will we go under 100 cases per day on average. And if things keep falling at the rate they have been falling, that could be very soon. I am hesitant to make promises to people, so that's why I'm saying a few weeks, I hope. But we're just watching the numbers.
As of today, in terms of restaurants, if they continue to mandate a vaccine card at a restaurant to come in, can they allow folks to drop their masks? If you're fully vaccinated, come on in, your mask can stay in your pocket.
Yeah, for months we've had an exception to the indoor mask mandate for any business, restaurant or other, that wants to say everybody who enters has to be vaccinated. Some of the gyms did this. They didn't want people to have to wear masks, so they said everyone has to be vaccinated, no exceptions. And then, yeah, and people can do this also at a time and a place. So a hotel that's holding a wedding and they want to do a mask-free wedding, if everyone's going to be vaccinated, you know, in that area of the hotel at that time, that's fine.
I just have a quick question for the mayor, if I could. Mayor, I want to follow up on something you said. Mayor, do you think the restaurant industry was irresponsible in its earlier mandates? You said that if we had listened to them, we'd have 2,000 dead. Did they act poorly early on in your view?
Yeah, we had restaurateurs that didn't want us to shut down at all. And we're arguing that they should just stay open. I mean, and 2 years ago, that would have been a disaster. So it's hard making difficult decisions. And that's why, you know, you're in public office. You have to make difficult decisions when people don't agree with them. But yeah, I think some of them were very irresponsible and argued that they should just stay open regardless of what happened. So it is what it is. I mean, thank God this isn't World War II, because when I look at the sacrifices people made during the Second World War to win that battle, win that war, if we had the same level of cooperation then as we do today, we'd be in trouble.
Thank you.
Thank you very much, Jeff. Next up, we're going to go to David Melandra from Philly Sports Blitz. Go ahead, David.
Just have a couple questions. One, with you guys dropping the vaccine mandate for indoor dining, does that include sports venues like the Wells Fargo Center, the Liacouras Center, and any casino?
It includes any establishment that serves food or drink, unless it's, you know, a hospital cafeteria or something like that. So yes.
And question for the mayor is, do you believe by, say, 4th of July, do you think the city will be mask free of everything?
I'm sorry, you broke up. Say again.
Do you believe by the 4th of July that the city of Philadelphia will be mask free and all the restrictions will be gone?
I hope. I mean, you know, crystal balls don't come with science and medicine. I mean, it is what it is. And trying to project what things may be like July 4th, I have no clue. But my hope is that within the next month or so, we'll kind of be back to normal. As long as, here's the bottom line: get vaccinated, get boosted, and wear your damn mask. This would be over by now if we had done all that. If other states, Florida, Texas, other, you know, cockamamie stuff that was going on, if they had all just followed the rules, we would be out of this by now. But it is what it is, and we're going to continue to follow the rules, whether people like it or not.
And my final one for the health commissioner. So you're saying the masking for indoors still remains, and does that include, like, say, for the Wells Fargo Center and other sports venues?
Yes. So indoor masking for now is still in place in Philadelphia.
Okay, thank you.
Thank you very much, David. Next up, we're going to go to Jack Tomzik from the Metro. Go ahead, Jack.
Thank you. Dr. Bedigal, was there evidence that the vaccine mandate for restaurants and other, you know, food serving establishments, was there evidence that that was effective?
Yes. So, I mean, you know, we did see cases fall in Philadelphia. From what we can tell, they appear to have fallen faster than in other places. But the thing that I have found the most compelling is that very large increase in our pediatric vaccination rate. So, you know, we're more than 20%, not relative, but absolute, more than 20% ahead of the national average now. So national average about 32%, Philadelphia more than 51%. So I'm saying this wrong, more than 53%. And that's just a huge difference. And it wasn't true in December. So, you know, we would have expected some rise in vaccination, but more to parallel the national average. So I think that's probably the biggest difference. And in terms of just our ability to get back to normal, that's huge.
And so if it's encouraging vaccines so much among, you know, children and younger people, why lift it now? Why not wait until, you know, encourages even more people?
I was waiting for someone to ask me that question. Thank you. All of this is a balance. And I've said from the beginning that we want to be the least restrictive necessary and that we would try to lift this as soon as possible. So, you know, it's gotten us a long way, but with cases dropping dramatically, positivity dropping dramatically, that it doesn't feel like we have to have it in place right now, and it feels unfair to continue it longer than we have to have it. So the intent was primarily to stop the transmission of the Omicron variant, and we are there. And then as a sort of a nice side effect, to increase vaccination rates, and it's done that. So we're over 80% fully vaccinated for our adults, more than half of our young kids. We need to continue to make progress, and we will, but it felt like it was time.
And just anecdotally, I've heard from some people who said that, they went to some restaurants, didn't check the vaccine card, were not in compliance. Was there some compliance issues among restaurants or other venues checking the vaccine cards?
So there's always some compliance issues with any policy, but in general, compliance has been excellent. We've had very few complaints. Our EHS inspectors report very high compliance rates. So, sure, there's imperfections in everything we do, but I think you can see from what happened with the numbers, both in terms of transmission and also in terms of the vaccination rates, that it had a big impact.
Right, thank you.
Thanks so much, Jack. Next up, we're going to go to Isabel Sanchez from Telemundo 62. Go ahead, Isabel.
Thank you, James. Dr. Bedigal, my question is about how will this work? Will you guys continue to offer every 2 weeks updates, and based on those numbers, restaurants and other businesses can adjust, or would it be a weekly thing? Just trying to understand how business owners can better, grab a grasp of the changes, because it's going to be a changing situation, to adapt to those different measures.
Yeah, and thank you for that question too. That's useful for people to know. So we are going to be updating the website on Mondays, I believe. Jim, check me if that's true. Monday?
That's correct. Every Monday, probably by the afternoon.
Great, thank you. So we'll update on Mondays. And in general, we won't do updates in between unless something dramatic happens. If we need to let Philadelphia know that something serious is happening, we'll do that. But the goal is we'll update the website on Mondays. We'll also put this information out in the press release and through our colleagues in the Commerce Department, through the commercial corridor managers, just to make sure people have the information. But I believe it's already on the website, so you can see what that page looks like. I think it's pretty easy for people to see and to navigate through.
Thank you. And just one more quick follow-up. Are you having conversations with the Commerce Department, as you mentioned, different business corridors, to talk about education so that business owners truly understand how this 4-level system works?
So we did some initial conversations, which I'm guessing the press is already aware of, since some of those became public. But we've had some initial conversations, and we will continue to work on getting the word out about this.
Thank you very much.
Thank you very much, Isabel. Next up, we're going to go to Jason Laughlin from The Inquirer. Go ahead, Jason.
Hi, thanks. Could you talk a little bit about the process of reaching this system? I know the department said you did not want to set a date for any mandate to drop or all mandates to drop. Are there any other cities in the country or around the world that are doing something similar to this with this set of metrics? And can you talk a little bit about how you came to this system?
Sure. Yeah. The problem that we all face, which you're probably aware of, is that there's no single metric at this point in the pandemic that tells us where we are, right? Cases aren't great because a lot of people are doing home tests, which is terrific, but it definitely impairs our data to some degree. Hospitalizations, there's the question of with versus for COVID. So whether people are actually in the hospital because of COVID or incidentally positive. The positivity rate gives us some idea of how available testing is, and is somewhat of an indicator of spread, but not perfect. And there's a thing that I had noticed with each of the severe waves, which was that I was seeing doubling of cases at a time when there were no other red flags. So we talked as a team, and we have a terrific team of public health experts, infectious disease experts. We talked with some external folks as well about how to put together a set of metrics that together give us a pretty good sense of where things are at. And we've looked at some historical data as well, to try to get a sense of would what we put together, would it have predicted Omicron, Delta early on? So it's been a very collaborative process. We then, you probably know, had some stakeholder conversations too, to get a sense of how this would land for the business community. So this has definitely been a team effort to put this together. I'm not aware of a similar set of metrics in other places right now. You know, this is something that we were hearing loud and clear from Philadelphia businesses that they wanted some transparency, some predictability. Of course, there's limited ability to predict time, but at least to give people, this is what we know, and get as close to that as we can.
A second question. The decision to keep masks requirements in place while dropping these vaccine requirements, you know, why does that seem safer? You know, what is the difference between a bunch of people who may or may not be vaccinated eating indoors, clearly without masks on, versus a bunch of unmasked people going to a grocery store or a museum? Why is one safe and the other is not safe at this point?
So, two reasons. So, you know, there's widespread evidence from all over the world that masks really do have a benefit in decreasing transmission of COVID. And we've seen that again and again and again. They're not perfect, but they make a big difference. The other thing, and actually it's great that this question came from Jason at the Inquirer, is that the Inquirer has been running this terrific graph of the case rates by county for months now. And what you'll see is if you look about 2 weeks, about a full incubation period after the mask mandate went into place August 12th, you can see that Philadelphia was kind of neck and neck with the counties, and then we dropped below them. And we've pretty much stayed below them until Omicron hit. And then briefly, we all went through the roof and came back down. So that gives us a nice way of comparing locally what happens with a place with a mask mandate versus places that have every reason to have local case counts, but don't have mask mandates. So, you know, that's kind of the reasoning there. The reasoning on lifting the vaccine mandate, as I mentioned, is just that it is a much more intrusive thing to do to businesses. And so we wanted to do it for as little time as possible. We needed it when we needed it, but now with cases dropping, we really don't need it in the same way.
And last question, as I'm sure you've seen, we've written some stories both before this came out and since from people who were given a lot of confidence by the vaccine mandate. Some of them were people who have health problems. Others are just people who were trying to be safe. You know, what would you tell them if someone says, hey, now I don't feel as safe going out to eat as I might have a week ago?
Yeah, I mean, there's definitely a downside to doing this. And all of this is a balance. I will say that because Philadelphia has a mask mandate, we're still a much safer place to go for people who are paying attention to these things. So, you know, coming to Philadelphia, keeping your mask on, going into stores and seeing other people with their masks on, it gives people a little bit more confidence. And I hear a lot from people who appreciate that when they go into stores. And of course, I hear a lot from people who don't appreciate it, but you know, it's a balance.
And very quickly, this all goes into effect today, correct?
It does.
Yeah, okay, thank you.
Thank you very much, Jason. Next up, we're going to go to Pat Loeb from KYW. Go ahead, Pat.
I have a question about the city worker vaccine mandate for Mayor Kenny. Mayor, is it a failure of leadership on the part of Commissioner Teal that he can't get his staff to do what they've been ordered to do?
Well, we're in the midst of a arbitration now. We've basically imposed what the FOP arbitrator ruled. It's good to see that the FOP is, I think, in the 80, correct me if I'm wrong, Dr. Bedigal, are in the 80s when it comes to 80% when it comes to their vaccinations. I think that the firefighter issue is purely political. Obviously, they supported Donald Trump in the election, and they bought into Donald Trump's stuff, and that's why they're resistant. It's very personally disappointing to me, coming from a firefighting family, that people who are public safety employees don't get it or refuse to get it when it comes to being vaccinated. But I think, Dr. Bedigal, our overall workforce is what, 80s, in the 80s?
I think we're at 84% vaccinated.
84% of our entire workforce is vaccinated. And our firefighters are probably in the 60s, if I'm not mistaken, Doc?
I believe so, yes.
Yeah, so I mean, I don't understand what that's all about, but I think it's kind of silly, and there'll come a time when people will have to address why they're not vaccinated. And I hate to get to that point, but they just refuse to cooperate.
But my question was specifically about Commissioner Teal and his inability to get his department to do what they've been ordered to do.
What's he got? is going to take out a gun and force them to go to get vaccinated. I mean, he's a great commissioner. He's very capable, a terrific guy, and he's doing his best. But people are resistant politically and ideologically. It's hard to force people, short of twisting their arm and dragging him to the clinic, to get it done. And I don't blame him at all.
Okay, thank you.
Thank you very much, Pat. It looks like we have a follow-up question from Mike D'Onofrio from Axios. Just so folks know, we do have a few minutes left that I want to make sure we get through all these questions today. Go ahead, Mike.
Actually, how about this? Maybe when you say maybe, because I'm looking at the, the tiers and the levels here. So when you guys say all clear, and the mayor says back to normal, what does that mean? Are you guys kind of saying like, we could go back to, before the pandemic and how life was in terms of restaurants, gyms, events, weddings, all that stuff?
So, as is true in so much of life, all clear is about restrictions. It doesn't mean that people can stop using common sense. So, we all know our own risk profile and the risk of our family and our friends. You want to think about that. When we reach that all clear, getting together with a few friends, great. Be careful about large gatherings still. This is still out there. So the absence of governmental restrictions doesn't mean that people shouldn't still use their common sense.
All right, thanks.
Thank you very much, Mike. Another one for Jason at the Inquirer. Go ahead, Jason.
Thanks. Do you know when the last time the city reached the level that would now be called all clear, and how long that lasted?
During much of the summer, cases were well below 100. Hospitalizations, positivity were all low. So we did spend a good amount of time this summer there. When after Delta hit, we never truly went back down all the way. We're already below where we were before Omicron hit.
Okay. All right. Thank you.
Thank you, Jason. Another question for Johan Calhoun at Chalkbeat. Go ahead, Johan.
Yes, Dr. Bedigo, you said the office is going to meet with the school district to discuss new measures. Can you provide a time frame for that?
I talk with the district frequently. We need to have a conversation about a number of things related to these changes with them, but we were waiting until after this announcement to do that. But those conversations are ongoing. So
we can expect something this week?
I don't have an exact timeline for. If the question you have for schools is about masking in schools, we're not making a change to that right now. The timing and the metrics for what would be a change, we still have to talk to the district about. So I wouldn't necessarily anticipate an announcement this week.
And I just want to get your thoughts about those numbers. People under the age of 18. I asked about African Americans and Latino, but just across the board, just give me your thoughts. Do you feel good? Do you feel bad? Are you still worried?
I'm still worried because it's kind of my job to worry, right? But I'm much happier than I was a few months ago. Our numbers for Latinos are actually pretty good. Initially they were low, and then we somehow reached enough people that I think they talked to their family and friends, and we crossed over a line somehow, and those numbers have shot up. With African Americans 45 and over, we no longer have disparities. But for the younger adults, for the teenagers, we still have some work to do, definitely better than we were. But that has been our major area of focus for the last few months. And the numbers, definitely getting closer. It's just there's still people at risk.
Thank you.
Doctor, we're still at the high level of diversity when it comes to people of color versus white folks when it comes to vaccinations, correct?
Our numbers are good relative to other cities.
Yeah,
and we don't have, we actually are a little bit higher for our vaccinations for African Americans and Latinos for age 45 and up. It's the younger folks.
Thank you very much. We're going to take a last set of questions from Annie McCormick at Channel 6. Go ahead, Annie.
Dr. Bedical, I'm just getting a little bit of feedback now that we have these numbers out. The data that we're showing in regards to, and this is kind of a follow-up to Jason Laughlin's question, for hospitalizations under 50, our data shows since September of 2020, the average hospitalization rates have only been under 50 on July 15th of 2021, and the percent positivity is under 2%. In regards to that, it has only happened periodically from June 8th until July 13th of 2021. If that data is correct, I mean, how feasible do you think it is to get to these benchmarks, to these tiers?
So you have to remember that Delta really hit Philadelphia before people understood it was there. And I remember standing at press conferences in late June saying, it is coming, I can see it. But we didn't have the numbers of cases, so it was hard to convince people. So the reason that I am confident of this is we were looking at Delta from early July well into November. And we don't have Delta in Philadelphia. 99.8% of what we have right now is Omicron. So, I mean, you know, it's been awful. And on the other hand, it has pushed the Delta wave out. So I do think we're likely to get there soon. And, you know, we are continually revisiting these metrics. So the one that I think is likely to change in coming months is actually hospitalizations. Because as hospitalizations become more and more disconnected from positivity, meaning as more and more of the people in the hospital who have COVID are sort of incidentally positive rather than there because of COVID, that metric will need to change. It's just that we need to watch that process happen before we can make that adjustment.
Okay, so would it be accurate to say that you're hopeful that we could be in the all clear in possibly weeks short of another strain hitting Philadelphia?
Yes, I'm quite optimistic that we are going to get there in the next 2 weeks.
Okay, thank you.
Thank you very much, Annie, and thank you, everyone. Seeing as we're out of questions and we've reached virtually 11 o'clock, I'm going to end today's briefing. Just a reminder, moving forward, we'll be holding these briefings every 2 weeks on Wednesday mornings. Details on the next briefing will be issued via Media Advisory. Thank you all very much and have a good day.